Hello and welcome back to the Sleep Spot, where we talk about everything sleep. My name is Dr. Messi. I'm a pediatric doctor, and I love talking about sleep because, well, sleep is really important for children's health. So today we'll be talking about nightmares, a common topic, something that we've all experienced at some point, either ourselves or through our children, or at least we'll remember more if it's our child who's woke up and they're coming to tell you that they're at least scared and they're worried. So nightmares, frightening dreams that happen in the later part of the night commonly. So they happen in the later part of the night because this is um, what's called the rapid eye movement sleep. So if you've ever seen your child sleeping and they're closing their eyes and you might notice their eyes moving quite fast, that stage is the rapid eye movement sleep stage. So when we fall asleep, this relates to everybody. We don't just fall into a deep sleep and remain in that stage or in that state the whole night. We sleep through cycles. So we fall asleep, we might then go into the deep stage of sleep, and then at some point in the night, we get into a lighter state of sleep, fall back again into a deep stage of sleep, then come maybe into this rapid eye movement sleep stage, and then carry on through the night. So this rapid eye movement sleep, the lighter stage of sleeping, and during that time is when the dreams happen. And if they're coming in a scary format for a child, then that's what we refer to as nightmares. So they come in different forms. We This is very common in young children and tends to peak in this primary school age group between sort of 6 to 10 years old, where their imaginations are much more active. In the younger age group, from around 2 years old, nightmares can start to develop, and they tend to take the form of either scary events that have happened, or particularly where they have felt scared. Not necessarily anything that has happened that is actually scary, but it could be fears of being left. So maybe you've started dropping them off to nursery because they've started going to nursery now, or you're now leaving them with you're leaving your child with another adult so that you can go to work, or they've got a different babysitter, a different childminder. All of these things that seem pretty normal as part of day to day, in a child, it can actually be a stressor, and particularly in the younger age group, they can start having nightmares in sort of that age group. As the children start to have more interaction with the world, or they're starting to have some more screen time, then the scary dreams can take a different form. It can now be about the TV characters that they've watched, um, or other things that they've experienced at school. So if your child has had a negative interaction, then that is sometimes what might come into their dreams as well. So nightmares are not all about what they see, which is sort of scary visions or something when they're sleeping. It could be feelings of anger or feeling of disgust, and anything that sort of stimulates these negative feelings can be perceived will be perceived by your child as a nightmare, and that can wake them up, and then they're fearful and they not want to go back to bed. So it's, as I said, it's very common, and we just need to think about strategies that we can help our children so that they either don't have as many nightmares if they're maybe having a lot of them, and also when they do have nightmares, how can we manage in that situation? So first of all, how can we help to reduce nightmares? So we also know that nightmares can happen when the sleep is disturbed. So you want your child to be having regular, good amount of sleep and of good quality as well. We've talked about how we can support our children to achieve this elsewhere, but essentially you want them to have to be well rested and to wake up feeling refreshed, having gone to bed at an appropriate time for their age, and having had a good amount of sleep overnight in an environment that is conducive for their sleep. So getting good amount of sleep helps, and then also thinking about the triggers. So if you're able to identify uh, what might be triggering the nightmares, then that can also help. For example, if it's your child telling you that they are dreaming of something that relates to a TV character, then it's quite important to look at what they're getting exposed to. Is it on social media? Is it something that you've watched on TV? Which is, again, why it's really important for parents to have an overall idea of what their children watch, so that you're able to unpick if you've got a problem, and then you can support them appropriately. Then also just reassuring them that actually these are just dreams. Sometimes that helps, so that it doesn't continue to occur and continue to decay. All right. So once we've done all of these things to help them, sometimes even having a nightlight can help, particularly if you've got a child who's got nighttime fears. We'll talk about nighttime fears and how we can support children a bit more with that. But having a nightlight or a toy or a teddy bear or a nice soft blanket, if that's something your child might enjoy, also can help as a form of something that provides comfort. Also, even looking around the room before they go to bed, just reassuring them that whatever that they've described to have seen is actually not there as well, can also help in managing in reducing the frequency of nightmares before they actually happen, or if they've been happening. So if your child is having nightmares or they've woke up, so we're talking about now the situation where the nightmares happen and they've woke up, they've come to find you. It's important as parents to remain calm. So, and being reassuring in that instance that it is just a dream, and settling them back to bed. If we make too much of a fuss in how we intervene in that time, it can reinforce the idea that whatever it is they've seen is going to actually come and get them if that's how they're feeling at that time. So we do need to just be calm and collected about it and say, well, it's just a dream. Nothing's going to happen to you. And then we just reassure children so that they feel safer at that point. There's also something called image rehearsal. So what this relates to is if your child is telling you, for example, particularly if it's something, a recurring theme that they're able to describe, and they tell you that, well, I am scared because for example, I'll tell you this. My son told me that, well, I'm really worried about going to bed because of that dream that I had a couple of nights ago, and about someone chasing them from the park, and they called the police apparently. And when the police came, the person chasing them then said, well, these boys were chasing me, and then they got thrown into jail. I don't know where he's got that from, probably from the time he went to the park at the weekend. But you can then talk about that in that scenario, and think about what he could have done. So an opportunity whilst they're still awake, so that if the dream is recurring, they've had a chance to think about a different ending to the dream compared to what they've had during sleep, if that makes sense. So if in the case of my son, for example, they got caught by this person who was chasing them, but you can discuss the dream and maybe have a different ending. Did they find an adult to talk to instead, or did they manage to outrun the person who was chasing them, or did they leave the park a bit earlier and this person never came? So whichever method, whichever path, is also almost like social stories, for example. So whichever direction your child wants to take the story, but having a positive ending at the end, it's almost like controlling that dream during an awake state, and practicing thinking about the ending that they would like to have, which is more positive. When they do go to bed, and the dream happens again, it's likely that they're able to have that dream with the different ending. So that can actually be quite useful, like a useful tool for some children if they're at an age that they can understand it. Even younger children, you can help them through it and have a conversation about that. Then another thing that can contribute to having a lot of nightmares that you can also help with is trauma or stress. So children tend to have nightmares within sort of 3 months of a traumatic event. So it's not always that the nightmares will begin the day after a traumatic event, and this traumatic event can take any form. It could be, a proper, like a road traffic accident, for example, or they've been bullied at school, or something negative has happened to them, that is quite serious, and they might seem well or they're fine with it at the beginning, but if and then a few months down the line they start having nightmares. The dreams might have nothing to do with the event, or they might take a completely different form. But it's important to then think back and consider if anything has happened, and if it has, then approach it and deal with it depending on the situation, of course, because it's difficult to be prescriptive, depending, because it can be anything. Children who've been subjected to abuse can also have nightmares, and the management of that situation will be very different from a child, for example, who has been involved in an accident. It will come down to support and psychological input. Talking therapy can also help. So, if there is any traumatic event that has occurred that is now contributing to your child having nightmares. Then there's something else that is often used in children who have phobias or even adults, desensitization. So if your child has a particular fear and it's coming out in their dreams, maybe they are scared of dogs, yeah, and or maybe they're not really scared of dogs in real life, or they've never actually had an experience of interacting with a dog, but they just happen to be scared. But most often children will be scared of something that has either happened, or they've had someone say they were bitten, or they were chased, or they've had a dog bark at them, even though the dog might have meant no harm, and the child can develop a fear. So you could then help them to get over that fear in real life, and that can help them to not have nightmares later. So, for example, you could start off by showing them pictures in a book of a puppy or and another child playing with a dog, for example, and later on you could help them to wave at a little dog passing by, and then you can progress to pet a little puppy until they're able to pet a big dog. And when they get to that point where they can interact with this dog and not be fearful at that point, then you'll find that the nightmares will also drop away, because that fear is gone. So you're removing the fear association um, from the theme. So even if they still dream about playing with dogs, they're no longer going to have that fear, and they're no longer scared. So they're not going to have those emotions of anxiety and fear that then wake them up, and they call that a nightmare. So you've helped them to remove all of that. Then there are books as well. So there are children's books that talk about nightmares, and some children who can read, or you can read together. You can help them as well to look at some books that talk about dreams, and reassuring them that they're just dreams. Then some children find it useful to have what's called a dream catcher. So you can make one with them, or you can buy one from the shops or online, and you can place it above their beds. So this then becomes like a tool to channel the dreams. So you're reassuring them that when the bed dreams are coming, they can package them into this dream catcher, and then they're going to be fine. And some children find comfort in that. To be fair, there are some children who actually find that to be really scary, because they might actually associate that with, well, it's catching all my dreams, and they can become very they can take that in a very different direction. So your child, or if you're not sure, it's a conversation that you might want to have. And if it's something that they think they could try, then you could go on and try it. So important things to remember about nightmares are they're very common, and they tend to take a different form depending on the child's age. They will happen more when your child is stressed, when they are ill, when they so stressed, ill, or when there's a traumatic event that has occurred, and when they're not getting a good enough amount of sleep. You can help them by making sure that they've got a good bedtime routine, they're getting enough hours, they're getting enough rest. And you can also manage when they're having nightmares, being calm, and doing all these things that we've talked about to support them so that they can sleep better. So, well, thank you for watching. If you found this useful, please leave a comment, like, and also subscribe. And see you next time. Bye.